Good morning, everyone. I'm Congresswoman Jan Schakowsky. I represent the 9th Congressional District of Illinois. Today, we're going to be talking about healthcare, particularly. We're going to be talking about diabetes, but in general, we're going to be talking about the advancements that we've been making in the Congress of the United States, the Democrats in particular, for seniors and for healthcare. There are action days today all over the country of members of Congress talking about healthcare. So this is a wonderful panel that we have. I want to just introduce who will be speaking. Daphne E. Smith-Marsh, who is a doctor of pharmacy and is also a certified diabetes care and education specialist. And then we're also going to have Steve Smith, who is a Medicare beneficiary and also a person who lives with diabetes. So I'm going to begin and just frame the issue here. So as many people know and should know, is that the Congress of the United States passed the Inflation Reduction Act that had many, many benefits on healthcare, on the environment, et cetera, but particularly things that help older Americans. And one of those things has to do with setting a $35 cap on the amount that it will cost every month for people who have diabetes to get insulin. And that will begin in January of next year. So we're very excited about that. I think it's important to note that in the 9th Congressional District, that we have about 9,400 people who are on Medicare beneficiaries. In the fact of having a cap of $35 a month in 2020 would have saved people in my district about $1,433 for the year. We're talking about real money here. So we introduced this and passed this legislation. President Biden was happy to sign the Inflation Reduction Act. And we know that unfortunately not a single Republican in the House or in the Senate voted for the legislation. And it gets worse, actually, because Congressman McCarthy announced a plan that he has should the Republicans take back the House of Representatives. And the first thing he wants to do, for reasons unknown to me, and I think most consumers and most people, wants to repeal the Inflation Reduction Act, which also, by the way, puts a $2,000 a year cap on what Medicare beneficiaries would have to pay out of pocket for the whole year. So it's not clear to me why he would do that. But we also found out that the House Senate Republicans are actively trying to stop it. And last week, Senator Mike Lee of Utah and James Langford of Oklahoma introduced legislation to repeal any kind of Medicare negotiation for lower prices, to allow, it would disallow Medicare from actually lowering with the negotiating with the pharmaceutical companies to lower costs. They call their bill the Protecting Drug Innovation Act. And, you know, maybe we can hear a little bit from our expert on, you know, what exactly that would mean to stop any kind of ability to negotiate. And so we are really highlighting today what this will, how this is going to benefit our seniors, our people on Medicare, and how it's going to make healthcare more affordable and more accessible. And so I would like at this point just to introduce once again Daphne E. Smith-Marsh to talk about, from her expertise, about the importance of insulin and lowering the cost of prescription drugs. Thank you.
Thank you, Congresswoman. And good morning, everyone. It's my pleasure to talk about this particular issue. I've worked with persons with diabetes for more than 20 years as a certified diabetes care and education specialist and as a doctor of pharmacy. I have a unique position to be able to see how the effect of medication costs has on patients. So currently for the Medicare cost, there is $4,430. That is the total drug cost cap before someone goes into a coverage gap, which is called the donut hole. So for many patients, particularly if they do not have the ability to pay for insulin at a reduced cost, they can reach that coverage gap very quickly. So this really impacts patients. So persons with type 1 diabetes, they rely on insulin. They have to have insulin in order to survive. We all do. But if their body is not making it, they need to have these products in order to live their lives. A lot of persons with type 2 diabetes, there's such a large portion of persons who have to use insulin in order to better manage their diabetes. So type 2 patients, that's the majority of persons with diabetes, they often are affected by the cost as well. There are currently 3 million Medicare beneficiaries that use insulin. So this impacts a large number of persons. And if we could help patients who sometimes are paying $300 a month or more. I have a person, 79-year-old male, who has been paying out of his pocket $300 because that is the cost for him under Medicare. So he has to really struggle with deciding, do I get my insulin? Do I get other medications? This is a real issue for persons. So I think it's important for us to really consider these are people with diabetes. We want them to have the best quality of life. We know that if they're not able to afford their medications, that will impact their care. And as a person who is really compassionate, and I think about social determinants of health, so we know that there are certain persons that might not have the same access to care. So the goal is to make sure that we could increase access. And so by having a cap of $35 a month for the cost of insulin, that is going to be a huge benefit for persons with diabetes.
I'm wondering if I could ask you a question.
Sure.
And that is, aren't there going to be costs for people who can't afford their diabetes? What happens then? Won't they end up with greater expenditures?
Absolutely. So I'm fortunate. I work in a federally qualified health center at the University of Illinois at Chicago. So we have ways to assist patients, but not all patients have that ability to have reduced pricing. So it really makes a difference if they're paying multiple hundreds of dollars per month. That is going to bring them to the coverage gap amount, and they have to pay so much out of pocket. And that brings them to the catastrophic drug costs, which is $7,000. Our patients can't afford that. So oftentimes, if they're starting their year off with the Medicare benefit for their medications, they might reach their cap in a few months of the year. Then they have to go the rest of the year paying out of their pocket. And that's a significant cost to persons with diabetes.
Yes, and we have heard incidents of people getting very sick because they couldn't afford their diabetes. Well,
Yes.
yeah.
And there are persons who stretch their insulin. So that's one thing to consider, is that they try to compromise. They might reduce the dose that they're taking every day so that the insulin will last longer. And that's not the best way to manage their diabetes.
Right. Steve Smith, you live with diabetes and are a Medicare beneficiary. And, tell us what that's like and what $75 a month will mean for you.
Yes, thank you, Congresswoman. And one of the problems I have faced in the past is trying to decide whether to buy diabetes medicine or pay my bills. I'm a senior. I'm on a limited budget, and so there are tough choices, it seems like, every month about what to do about my diabetes.
And will the $35 a month really change that calculation and make it easier for you?
Very much so, and it would be a tremendous benefit and help to me as a senior.
Absolutely. Well, really, that is pretty much what I wanted to share, in addition to the cap of a total of $2,000 a year that under the Inflation Reduction Act, that people who are on Medicare that's the only cost that they'll have to bear. But I do want to go back to the notion that one of the other aspects of the Inflation Reduction Act is to begin finally to allow Medicare to negotiate for lower drug prices. What the White House had to say. This is what the White House had to say about the legislation that would prevent any kind of negotiation. The White House press secretary said their new bill is a giveaway to Big Pharma at the expense of seniors. The very idea that they would not want negotiation for lower drug prices when Americans pay 2 to 3 times more for the exact same medication as is available around the world. So, we are at the mercy right now of Big Pharma, who is charging too much for insulin, too much for all pharmaceuticals for seniors and for the rest of the population. And with that, if there are any questions, I think our esteemed panel would be happy to answer them.
I believe there's a question from Kathleen Smith, but I think it might be Congresswoman. I think you're muted right now.
Kathleen, are you there? There we go.
She's still muted.
There you are. You're unmuted now. Wait. No, you're still muted. Give it one more. I saw it go on mute. Give it one more try to unmute, Kathleen. No. Can't seem to unmute. She's got her hand up, but I can't. Kathleen, are you there?
I am.
There you go.
I would just like to say that I'm totally committed to the fact that the cost of insulin should be $35 a month for seniors particularly, and those who have diabetes.
Well, I appreciate that. Are you someone who does have diabetes?
Excuse me?
Do you have diabetes?
No,
Okay, we were hoping originally when we passed, that if we could pass the Build Back Better bill, that $35 would apply to everyone. Unfortunately, in another instance, the Republicans voted to squash that. So we thought at least if we could get it just for the Medicare beneficiaries, but hopefully we'll be able to, in the near future, extend it also to everyone, not just people on Medicare.
yes, that should certainly be the way it should be done.
I think it really is important to understand the cost of diabetes in the economy, which is enormous. It's absolutely enormous, of course, for one reason, because the medication has been so expensive, but also because so many people have diabetes, don't have the money to actually take what they need to address it. And so the cost of diabetes, if we could reduce that in the United States of America, there would be a lot more resources available for other healthcare issues. Anyone else?
Congresswoman, can you hear me? It's John Garcia with Channel 7.
I can hear you.
Wonderful. Thank you. You kind of just addressed the question that I wanted to ask, but maybe I can ask in terms of what do you see as the possibility of spreading that insulin cap to everyone, not just Medicare recipients?
I think it's really huge because we see many people who are under, excuse me, under Medicare age and eligibility, who also have, lots and lots of money that they have to spend. As you heard from, that it can be hundreds and hundreds, even thousands of dollars a year. So, and I just want to make the point too, that when insulin, which is about 100 years old, was first discovered, the great person who brought out insulin was asked, and who's going to have the patent and how much is that going to be? And he said he would take it for $1 because it was so important and such a boon for humanity. Well, we have seen that Big Pharma has a different view right now, and that's kind of charge what you can get away with. And so that's why it would be important to expand it to all people with diabetes.
What do you feel the prospects are of that actually happening at this point?
Well, I'm going to be honest with you. The prospects, if we already know that if the Republicans get control of the House of Representatives, that we won't be able to expand it at all. And so I think the midterm election is going to have a very important consequence. I'm just saying that people ought to make sure that the issues that they care about, which are going to be on the ballot, not in name, but in principle, they will be on the ballot, that the people they vote for agree with them and share their views.
If I could ask, if I could ask Dr. Smith-Marsh,
Yes.
have you had the experience? You mentioned patients kind of rationing their insulin use, and I have been assuming that is more for patients with type 2 than type 1. But maybe you could distinguish there a little bit.
Absolutely. So thank you, John, for the question. I've actually seen it in both type 1 and type 2. So type 1 patients, their pancreas is not able to make insulin or makes a very small amount. So they rely on insulin in order to survive. For type 2 patients, we often have to use insulin in order to best manage their blood sugar levels. So I've seen both. One of the things that I think is encouraging with this particular act is that in July of 2023, persons who are using an insulin pump will also have additional benefits, which will help them with the cost. So this is going to really impact a lot of people. But John, this is a real problem. Like Steve mentioned about deciding whether to pay for insulin or whether to pay bills. This is something that I see all of the time. And oftentimes it's at the end of the month. So when they're running out of some of their other benefits that they have for the month in order to afford groceries or afford other things, they sometimes are reducing the insulin doses. So we're seeing blood sugar readings that might be higher at the end of the month due to this. So this particular benefit of just $35 per month and the cost of insulin is going to be so helpful for a lot of persons.
Let me just also add that a few years ago, when a young man who had diabetes went over the age that he could be under his parents' policies, this is type 1, in order to manage his diabetes on his own, he tried as hard as he could. He lost his life. He
Yes.
lost his life. There are casualties of people who cannot afford their insulin. Anyone else? Okay, there's no more questions right now. I just really, really want to thank our panelists. It means so much to me. Thank you, Steve Smith. Thank you, Daphne E. Daphne E. Smith Marsh, for bringing your expertise. And it's been a pleasure to talk to all of you. Thank you so much.
Thank you.
Thank you so much.
Yeah.